you very much, Adelit, for the kind introduction, and hello, everyone. So, yeah, I'm going to talk about the technical aspects of our collaboration. And yeah, you can see here in my title slide an image. As you can guess, it is generated by generative AI using Microsoft's Bing's DALL-E image generator. It is not exactly what I wanted, because I wanted to really have a baby with cleft lip and palate. Doesn't look so, but it was at the end okay. It is better than me having to do this myself, right? But I want to also show you the iterations, because I didn't get this at my first trial. So the first input I gave to the image generator, robots operating a baby with cleft lip and palate. And this was a couple of images I got. So here, for example, on the left, you can see that the baby is more like a robot, and then here on the right you have just one. Yeah, and I tried with different prompts, different inputs. Here is another one, a lot of robot arms, and then another one where the baby suddenly became too big, right? And then here's another one. I try to be more descriptive in my input, but the image became more synthetic, right? And then here the baby is not lying anymore. And then I was even more descriptive in my input. So I said clearly visible cleft lip and lip lying in the surgery room. But then it gave me something that doesn't look like cleft anymore. So yeah, I had to iterate several times until I got something similar to what I had in mind. So you can see AI is not perfect. It can save us a lot of time, right? But it is not yet accurate. Of course, it also depends on the field, right? In some fields, like let's say computer chess, it can beat humans very easily, right? We know that for many years. But for some fields, it's more at its infancy phase. And yeah, and the title of my talk is whether AI can bring a revolution to this field. And actually, for this question as well, I once more went to the AI, and I asked this to AI itself, to ChatGPT. And so I asked the question, and then it gave a quite dramatic answer. You can see here, it says, cleft lip and palate in the 21st century has immense advancements, and AI has the potential to contribute to the revolution with the following aspects. So you can see early detection, surgical assistant, genomic research, education and training. But several of these aspects are actually the aspects we have been already working on in this project. For example, personalized treatment plan, Andreas also mentioned access to care, right? And I specifically asked ChatGPT what he thinks about pre-surgical plate therapy, and then it says, AI can assist in the design of custom orthobitic plates tailored to the specific needs of the patient. So this is exactly what we are doing. So let me start with that. So the plate design the traditional way is cumbersome, right? You need to put the silicone impression into the mouth of the baby, and then a dental technician prepares this plaster cast, and then on top of this plaster cast, manually plate is prepared, right? So you need a human in the loop. But with some AI techniques, with the intraoral scanning, we managed to make this process completely automated and digital. So here is an overview of how it works. You start with intraoral scans of the baby, right? Or it can also work with scanned plaster casts. And then here is where the AI comes in. We do some landmark prediction automatically. This can be done also manually, right? It's not so difficult, but you have to teach the user how to pick these landmarks. So these landmarks, they help us to understand the 3D geometry. And actually, this is maybe not really an AI. It's more simplified from AI. It's rather machine learning. But this is what we need for this pipeline. And then the rest is some mathematical operations, registrations, and then we get a segmentation of the 3D palette, right? This segmentation is important because we have to know where the plate should touch the palate, where there should be a safety distance, where there should be this breach, etc. And then we have this 3D model of the plate, individual plate, and then we send this to a 3D printer, and then it's ready to be given to the patient. So here are a couple of examples for both unilateral and bilateral clefts. You can see here in a 3D view, so these plates, they satisfy the requirements. They touch the plate on the ridges. There's a bridge here. There's a safety distance. So, and then since these plates were approved for patient use by our collaborators here in Basel, we also actually developed a graphical user interface so that it's easy for them to design these plates themselves. We don't, this is a Blender user interface, and you just need to upload the scan, 3D scan of the baby's intraoral region, and then this neural network running behind this with this user interface, it can just pick these landmarks automatically, right? You can pick some parameters here, but you don't have to. You just can just click on the generate plate, and in a couple of minutes, the plate is ready, and then this is sent to the 3D printer. So far, approximately 40 patients have been treated in India, in Switzerland. Here you see our colleague Prasad, who was there in India to deliver these plates, and of course this makes us quite happy and proud. So now let's move on to another aspect that was also suggested by ChatGPT: low-cost intraoral scanning. As Andreas also mentioned, these scanners they are a bit expensive. Maybe not for Switzerland, but for underdeveloped countries, it's not maybe easy to afford such scanners everywhere. So that's why we are investigating this low-cost option, right, where one can put a mirror inside the mouth of the baby, and from this mirror we take a video with a smartphone that doesn't cost much, and then from that video we are trying to reconstruct the 3D geometry. So, but it's not an easy problem, because it's not like any 3D reconstruction problem. There are some challenges. For example, if you can see, there is not much texture that the 3D reconstruction algorithms can exploit. There are often occlusions. The medical tools or the lips are occluding this. There are also reflections on the mirror, you can see. It's also, there's also motion blur when you take the video, out of focus problems. So it's a challenging problem. But we developed a 3D reconstruction pipeline, again, using some AI tools. We have an input video, and then we do some pre-processing to mask out the plate region, the palate region. And then we use Lofter. It's a neural network-based reconstruction method, feature detection and reconstruction method. From that, we pass it to a deep STF model. It's a shape prior we developed on the training data. We have over 700 intraoral scans and scans of plaster casts. And this deep shape prior allows us to denoise the reconstruction, and then from that we can obtain a nice mesh reconstruction. And here you can see some examples of the reconstructions. The first column is the intraoral scans, 3 intraoral scans, and then on the second column we have the 3D reconstruction that we obtain using this method. So it doesn't have color, but we don't need the color to generate the plates, because generating the plates is our ultimate goal. And then it gives a nice reconstruction quality. I have to say it's not super robust. It very much also depends on the video quality. When the video quality is not good enough, then it can also fail sometimes. But for now, the results are quite promising. And we also generated the plates based on such inputs, right? That's the ultimate goal. Here you can see the intraoral scans in the first column, and then plates computed on intraoral scan, plates computed on 3D reconstructions from smartphone, and they are very similar to each other. So now let's move on to another aspect, which is personalized treatment planning, right? This is important because this way one can plan the surgery in advance and this reduce the risks for the after surgery. And for this, we are developing an infant face model because the existing face and head models in the literature, they are mostly developed for adults, and they don't work well for infants. So these such face models and head models, they allow us to provide some statistical estimates about how the post-treatment face should look like aesthetically, right? So that's also one project we are currently working on. But here our approach is more statistical. So far we didn't take physically consistent approach. And what I mean by that is that one can also create a more detailed digital twins of the patients. Here I will show you some results from a collaboration that we have with Align Technology and University of Geneva, using only 3D facial scans of a patient. We can estimate the underlying skull without using any CBCT. And we have quite good accuracy, around 1.5 millimeters accuracy. And this is actually quite relevant for babies, right? For babies, it's even more important to avoid radiation. And once we have this 3D digital twin of the patient, we can do, for example, surgery simulations, or in this case, we are doing orthodontic treatment simulations. Because during the orthodontic treatment, when the teeth move, the soft tissue is also moving, right? And we want to visualize this before the treatment. Here you can see this movement of the soft tissue due to the orthodontic treatment. And when we have this simulation, we can also photorealistically visualize this. So here we use also a method based on neural networks called neural radiance fields. So we developed a method to visualize these subtle changes. Let me play it again so that you see it better on the lip. On the lip, you can see this soft tissue movements due to the teeth movement. So, but the title of my talk was asking about a revolution, right? When is this going to happen? But for that, let's look at the meaning of the word revolution, right? And a bit on the history. So revolution has several meanings. It can mean political revolution, right? Usually they are violent. It happens suddenly. Of course, there can be some good reasons and background, but usually they are very quick developments. Personally, I'm not very much fan of these revolutions. I have to say, I think they can be quite violent and counterproductive. And I think AI doesn't fall into this category. I'm quite sure about that. I don't think we will wake up one day and AI is controlling everything. So I think AI rather falls to another category of revolution. It's a great change in conditions, way of working. For example, scientific revolution or agricultural revolution, which took centuries, right? Or one can use the word revolution for technological revolutions. For example, internet revolution or computer revolution, which take typically a few decades. For AI, I also expect, I think, similar time span. I think it's going to take a few decades. And but we are already seeing its effect in our lives, right? So then what is a revolution? If the revolution is really an artificial general intelligence that is replacing completely the human beings, I think probably we'll see this in a few decades. I mean, I can be wrong, right? It's difficult to forecast. Maybe it will come faster, maybe it will come later. But in any case, I don't think robots are replacing the surgeons anytime soon. And also, I think we should always be aware of the hypes around the AI, right? This is often the case when we talk about the technology. There were some Bitcoins were very popular a few years ago. People were investing their monies to Bitcoins, but then it crashed, right? Also with the metaverse, until last year, it was very popular. Companies were selling properties in the digital world, and suddenly ChatGPT arrived, and then it was forgotten. So, and for AI as well, There were actually, this is not the first time AI is becoming so popular. As you know, in the past, there were also AI waves, AI winters, and it is possible that we will see also an AI winter. Maybe not, but I think it's good to be prudent about this. And here are some final thoughts on AI in Cleft care. I think it's important to deliver what we can already with the existing state of the art, right? So we don't have to wait for very sophisticated AI. Already with the existing capabilities of AI, we can already deliver some solutions to the patients, and which is this is what we have been doing this project so far. And also personal treatment and surgery plan. I think this is quite important because if I understand correctly, surgery and treatment, this depends very much on the talent and the experience of the surgeon and on the health facilities, right? So I think it would be nice to have a minimal standards worldwide. So if we can do this with artificial intelligence, where the surgery plans are automatically computed for a given patient, that would be really, really helpful for the patients worldwide. And one can also do this data-driven, right? If we have data of Cleft patients with their 3D geometries, with the surgery plans applied, with the outcomes, and one can also get more accuracy in the such treatment planning. And AI is not the only cool technology out there, right? Augmented reality is, I think, also quite promising for medicine. For example, once we have such automatically generated surgery plans, and the surgeon can put on AR glasses and then just follow the surgery plan during the surgery, and this can increase the accuracy. And also it can be used for the training of the young surgeons. And finally, the robots doing the surgery autonomously, I think that's a distant goal, but one can already try doing robot-assisted surgeries, and for Cleft and Palate, I have seen some research about this. I think this is also a quite promising direction. And finally, I think for bringing these solutions to the patients, interdisciplinary research is very important, right? Because we as engineers, AI researchers, we don't know what the patients need, what the doctors need, right? Only the doctors can tell us what is needed, what is relevant. So for me, it was a great pleasure that I've been working in this project with our team at ETH and with our collaborators in Basel. And I hope in the future we can achieve even more. Yeah, I would like to especially also thank Botnar Foundation, which made this research possible with their generous funding. Yeah, thank you very much for your attention, and then probably you'll get the questions at the end, right? All right.